We are excited the mayor and council recognize the benefits of this effort and expect the momentum to continue as we strive to reach more qualified candidates. With this hiring and the mayor's proposed increase in the agency's overtime budget, we are better positioned to address employee wellness, reduce workplace injuries, the potential for use of force, and other negative officer-resident interactions. At this point, I'd like to address the issue of contraband introduction and its safety implications for our facilities. DOC employs a zero-tolerance policy and immediately bans anyone found attempting to smuggle in contraband of any kind. In FY25, the department acquired new body and package screening devices for our busiest entrances, and we've also added 3 additional narcotics-trained canines that have come online for operations. Clearly, the more detected and confiscated on the front end, the better our chances of remaining a safe and secure environment for residents and staff. The department will also continue to seek prosecution of persons involved while remaining focused and vigilant in our introduction efforts. With our FY26 budget, DOC will offer program opportunities, including mandated and advanced educational services, workforce development programming, along with reentry support for those under our care. Additionally, our tablet programs remain very popular with residents as we expand that programming and educational options and work to make more of the facility available for wireless connectivity. Our commitment to providing educational services remains unwavering, even with financial resource challenges. DOC will continue supporting at the same financial level services to our current and entering resident students with individualized education programs, IEPs, through the assistance of a third party during FY26. DOC remains engaged and excited about our plans to design, construct, and deliver a new jail annex building on the DOC campus within the mayor's Grow DC plan. Although there has been a pivot in our approach, which will now be toward a public-private partnership, or P3. This change supports construction of the new jail annex on a faster timeline. And to clear up any misconceptions about next steps, the mayor has stated that P3 involves the capital construction phase of the physical facility only and not operations, with the district and DOC will maintain all operational and staffing functions for the new facility. Further, our design planning with CGL, the Department of General Services, and the stakeholder community will not be interrupted with the P3. There is, in fact, $5 million within the mayor's capital funds directed for continued jail planning and pre-design services, which we have been doing on an ongoing basis. To date, we have held a total of 24 public sessions, which will continue as we work together to plan for a state-of-the-art facility focused on rehabilitation, reentry, and the safe, secure, and humane housing of district residents. Mayor Bowser's FY26 supports the agency's mission and priorities as we work toward becoming a benchmark corrections agency. I thank you for the opportunity to testify and look forward to answering any questions you may have. Thank you.
Great. Thank you so much, Director Faust, and thank you to your team and everybody who works at DOC. These are very difficult jobs, and we really appreciate all that you do every day and your partnership and collaboration. And I am grateful you talked about this in your testimony, but appreciate the focus you all have had on limiting contraband coming into the facilities, especially drugs, when we need to make sure that we're keeping everybody safe and not have overdose deaths or harms that those can create. So I want to ask you first about the construction of the new jail. The mayor proposes striking the full $463 million allocation for the construction of the new annex. From your perspective, what is a reasonable timeline that we can expect progress to be made on a P3?
Well, again, we're continuing to progress uninterrupted in our pre-planning and design process. As I mentioned, first off, there is $5 million in the mayor's budget toward continuing the design process that we've been doing on an ongoing basis. And I really think the common goal, I think, across the board, whether it's from advocacy groups, from DOC, from the council, from the mayor, I feel the common goal to everyone ultimately is to close the CDF. And it can actually be done and accomplished faster with a private entity. And again, so in answer to your question, to continue progress, we are in fact continuing the uninterrupted, the pre-planning and design process that we're doing now with the CGL group that we have along with DGS. And that $5 million is in the FY26 budget. And in addition, we have $23 million in hand toward that, toward the ongoing process. So my understanding, and again, the RFQ and the RFP process will be under Department of General Services, but they would be moving forward to their goal, to my knowledge, is that to have a RFQ, RFP process out by sometime, I believe, late summer. That would follow from, the pre-design that we've already done.
And what would that mean for construction timeline?
I'd have to defer specifically to DGS on exactly what the startup would be, because I don't know how long that RFQ, RFP, would go out. I could certainly get back with you or defer to DGS. But I think an important thing too, I'd like to mention there on that is, because I had heard some concern from at least one of the public speakers last week, was in terms of, would a private entity come in and like change the design completely and, get
Right.
away from what we're doing? Well, absolutely not. That in the RFQ, RFP, they would be bound by our design concepts. So that would be a requirement. So in other words, the conceptual designs will continue and would be required as part of that, and they would be bound by that. So in other words, a company coming in would have to meet the Hill East Master Plan. They would have to meet, as we've already been in front of the federal entities, the Commission on Fine Arts, the National Capital Planning Commission, which have both reviewed those design concepts. So I did want to point out that if there was a concern there, like someone could come in and just, change the whole boat, that would not happen because they would be bound by those design concepts.
Okay, no, that's certainly good to hear. And one of the things that I would like us to think about as it relates to the design, in addition to the conversations that have been ongoing about rec space and kind of kitchen space, is as we contemplate what a future could look like if DOC were to house people from BOP facilities at the end of their sentence, as they reintegrate into society. I want to make sure we would have sufficient units to contemplate that type of agreement. In terms of the financing, what is in it for a private construction company to build this? How would we be financing their deal? Would we be paying them monthly rent? And if so, how much would that be estimated to be cost?
I would not be able to give you those estimates. I think that would have to come through the but through the budget office and or DGS on that.
Okay.
But essentially in general terms, I can tell you that a private group would come in, a private entity would come in and construct the facility. Again, it would not be the operations, but simply construct the facility. And then essentially, and again, under the P3, that would not be against the capital debt for the district, as I understand it. And that it would essentially be, I guess you could look at it like a lease back. So they would build the facility, and then over a set number of years, there would be payments made by the district. And then at the end of that period of time, and that would have to be set, by the district government and the entity in terms of whatever agreement would come about. And at the end of that time, then it is, turned over fully to the district.
Okay. I guess I'm trying to get a sense of how far along we are on a RFQ, because in the budget presentation, it was shared as though this could be something to speed up the project, but I'm not getting the sense that we have firm dates of kind of when construction would be
Again,
built, which is something
I'd
I
have
would
to
imagine they
defer
would
to
include you
DGS
on.
on that.
Okay.
I believe the part that speeds up the process and helps speed up the process is that as part of the public-private partnership, the entity private partnership comes in as part of their bid. They have the architect, the contractor, all of those services already as part of their plan. And so if it's part of the district's budget or the district's plan, the next step would be to do an RFP or RFQ for an architect. Then after that, we have to do a contractor. Then after that, we have to do, so by going the public-private partnership, that private partner comes in with an architect and with a general contractor and with all of the services ready to go. So it speeds up the process in that way, in that you don't have to go through the district doesn't have to go through each individual solicitation round and to get those individual services. It's already done.
Yeah, no, I appreciate that. And I think in general, there are a lot of benefits of having a public-private partnership for a major construction project like this. I just want to make sure before we pass this budget that when we have such a large capital allocation moved out of a project, that we're still seeing progress towards getting to that goal. Like that makes sense in theory, but of course it's a DGS project, but I would imagine DOC would be very involved in those conversations, especially if we were getting close to an RFQ.
Right. And again, the work that we have been doing on an ongoing basis is continuing unabated in terms of our pre-planning and conceptual design work.
Okay, great. In terms of the CCB, there's the $2 million in FY26 for the construction at the Daily Building. I just want to make sure, 22 million, that is going to be sufficient from your view to stick with the plan of the temporary relocation of 501 New York Avenue, and then we'll return to using the central cell block after that renovation is completed.
Yes, we are on track to move on a temporary basis to 501 New York Avenue in the springtime of next year. So essentially about a year from now in terms of actually operating it. So yes, we're on
Springtime
track.
next year to operating which location?
The 501.
The
New York
501.
Avenue, right.
But
and then we will temporarily be in there as swing space. And while we're there, then the work will be beginning for the renovation at Daly, for the CCB at Daly.
Okay, and that temporary period will be 18 months?
I don't know exactly what that period is. Again, I'd have to get a better feel for DGS on that.
It's going to, so the first, the capital budget for FY26 includes $2 million to begin the design consult, to get, basically to get a design consultant to look at the current CCB in order to determine what needs to be done, how we can improve it, what improvements can be made. So first we have to get an architect on board to be able to look at those things. And then after that, the rest of the funds come into play in outlying years in order to begin to do that work, in order to do that. So it's going to take a number of years before we're back to CCB at the Daily Building.
Okay, well, that's very concerning because the commitment made to me by the executive was that this would be 18 months. And that's the commitment that I made to the community.
I believe 18 months was the period of time for the construction and move in for the into 501 New York Avenue.
And if you look at all of the work we've done with the zoning commission and the like, we're at a 7-year plan with that's what's with the zoning commission. And as part of the record with the zoning commission, all total, I believe we're at 501 New York Avenue for at least 7 years. I mean, that's part of the public record with the zoning commission. So 18 months was the move out of the plan for us to move out of the current Daily Building into 501 New York Avenue for construction there.
Yeah, 18 months was the period of time to have 501 New York Avenue prepared.
Okay, that is news to me. I'm very concerned about this, but we'll follow up. I'm going to turn to my colleague for a 10-minute round.
Thank you, Madam Chair, Director Faust, members of your senior leadership team. It's good to see you. Director Faust, you and I both know that as the district continues to grow, oftentimes our returning citizens are not included in that process and left behind. Now, the mayor's proposed budget is titled Grow DC. Could you speak to how your budget supports that effort, especially for returning citizens who may be coming home?
Absolutely. Thank you for that question. We're very pleased in that we have in the FY26 budget continued funding at our continuing funding levels of 2.4, is it? 2.1, I'm sorry, $2.1 million toward our Lead Up, Lead Out program, which is all part of our reentry programming and planning and preparing individuals for reentry through educational programming, job training programs, and then moving into the Ready Center and the services we give there. I'm also very pleased that we have continued funding, although it's actually over in DGS's budget, but we have continued funding for the next fiscal year to ensure our ongoing lease of the building for the Ready Center. So all of those reentry programming that we have will not only will continue, but are continuing at without reductions, in fact. And I'll have Deputy Director Williams can speak to some specific programming if you'd like to hear some of the
I will
items that
wait
we
till
do
that.
in terms of starting with Lead Up, Lead Out, and then how that works into a returning citizen, then moving over to our support services at the Ready Center.
Well, Deputy Director, before you respond, my question may be geared towards that. So, Director Faust, I noticed that your overall operating budget has increased, and however, your FTEs have stayed the same. Could you explain what you plan to do with that extra tranche of money or increase in funding?
Which funding
So
specifically?
your operating budget funding has increased. However, your FTEs have stayed the same. Could you explain how those increased funds will allow you to better deliver services to inmates?
Again, well, part of the increase is, as was said, is reflected in a additional right sizing, so to speak, in terms of overtime pay to continue there. There is also other monies that go toward our PS for personnel services. But again, our programming as it relates to reentry specifically,
Mhm.
we're continuing at that full funding level. And we do not anticipate, based on what we've seen over the last year, we're not anticipating any, increase in the population. So some of the areas we're able to save on is that going back, say, a year ago, we were projecting based on very fast increases we had a couple years ago after the emergency legislation, crime legislation.
Yeah.
But those increases have now clearly leveled off. So we're not going to continue to grow at that rate. And so we now have a leveled off population.
Yeah.
And so based on that, while we're able to have some cuts, but it's not cutting services.
Okay. Thank you for that, Dr. Frost.
If I may,
Faust,
Councilman,
uh,
just to add to what you're
yes.
saying. Thank you so much. So the programs and services that we do have at the facility is not just by DCDOC.
Okay.
We have a number of partners. We have over 300 volunteers and contractors that come in and provide services, programs for our resident population, as well as over 101 partners at the Ready Center. So they come also with their own budgets,
Yeah.
with their own specialized services and programming that they add to what we are currently doing inside the facility.
Thank you, Deputy Director. Director Faust, I know that your FTEs have stayed the same from FY 2025 to now. I also know that there's been an increased number in deaths. Could you speak to how your budget plans to keep inmates safe? And do you think with the increased number of deaths, do you have the workforce needed to keep inmates safe?
Yes, I do believe
Okay.
we have the workforce needed to keep inmates safe. Now, we do have vacancies we need to hire into, and which we are aggressively doing. And as I said, we've seen some real positive results from the mayor's budget in terms of our bonus for hiring and retention of staff. And in fact, as I mentioned in my opening statement, our upcoming recruit class will be the largest one that we've had since before the pandemic in 2020.
Thank you, Director Faust. Chairperson Pinto spoke to this in terms of the jail and the capital funds that were associated with construction for the facility. Now, you guys took a significant hit in capital dollars. Could you explain how the decrease in capital funds will impact your ability to conduct much needed improvements to the facility?
It will not. In terms of our capital money for ongoing maintenance, ongoing capital projects for upkeep, that money remains the same. The reduction or the removal of capital was specifically for the construction of the new jail annex, and again, that's due to a pivot toward a P3.
Thank you, Director. I noticed that in your budget, there was an increase in federal grant funds. Could you speak to what additional federal grants that include?
I'll defer to Deputy Director or our AFO.
Yes, the increase, I think, is 68,000. Is basically it's not a new grant; it's a carryover from previous years. So we had to right size it to what the carryover was from the what we anticipated to be in 25 from 25.
Thank you. Director, in your proposed budget under agency management programs, I noticed that logistic management saw a reduction in funds. Could you explain what that program entails and how that will impact keeping inmates safe? The amount was it was a modest amount, but it was I want to say it went from $9,196,000 to $9,109,000. a negative 86.
So the bulk of this program is the changes from salary adjustments.
Okay. How will this impact keeping inmates safe, if any? Oh, okay. I noticed the same with the inmate personnel services. Uh, Similar question. I noticed a reduction. Could you speak to any impacts?
Yeah, it's no impact.
Okay. And I also noticed that under the community corrections, under post-release services section, there was a decrease as well.
That was just right sizing the contract we have with our community corrections
Okay.
contract, our Fairview contract.
Now, Director, I mentioned that there was an increase in your operating funds. Your FTE stayed the same. Based on your testimonies, based on your testimony, you highlighted your priorities and some of the things you're excited about. Could you speak to, if any unanticipated challenges that your budget will produce? And do you feel like you have enough adequate funding needed to keep?
Yes, I do feel our budget is adequate
Okay.
to handle all of our responsibilities and duties. There are no unexpected, again, as I mentioned, which we don't expect, but the only, I guess, caveat would be if there was some unexpected, sudden, large increase in the population itself. But again, based on what we're seeing and the leveling off of that population, I don't expect that.
Thank you, Director Faust, as well as members of your team. I appreciate that, Madam Chairwoman.
Thank you, Councilor Felder. Okay, Director, let's talk a little bit about staffing and some of the ways this budget will help fill some of your vacancies. But given the context of Congress cutting our budget, yielding no federal savings in the middle of the year, has those hiring freezes affected your agency, and did you seek and get granted a waiver?
No, there is a process, as you know, for filling positions to get a waiver. And we have done so in terms of, positions that we have asked to fill because of, mission critical positions or positions that would affect the safety and security or operation of the facility. And so we have been able to both request and get approvals for those. And that
Okay.
process is working well.
Okay, glad to hear that. And then in terms of overtime, I know in a perfect world, we wouldn't need any overtime and every position would be fully filled. But given that last year's actuals for overtime were over $30 million, and then the mayor's proposal includes 18 million for overtime for next year, is that realistic?
Well, again, the $4 million add-on to the overtime budget is a adjustment that there has not been an adjustment to our overtime for quite a while. So with that 4 million, that continues to more right size our budget. What we're doing is have a extremely word I'm looking for, aggressive management for our overtime to really look at where that overtime is going, who's it being spent on, in terms of what people's salary levels are, or, management, non-management and ever. So we really have done a deep dive, and I'm very pleased that over this past couple months and going forward with pay periods, we've set a goal, and we've come under that goal for overtime now, with this just more aggressive management on a day-to-day basis in terms of call-ins for overtime. So I feel good about the direction we're going in terms of better managing our overtime resources.
Okay, so
Now, will I meet the $18 million? We'll be over that. We'll be over that,
okay.
but we're continuing to make positive steps.
Are there any other tools that you're planning on using to either attract folks in the door or to retain your staff that is going to be different this upcoming fiscal year than you're currently doing?
Well, different, or a couple things. One, as a continuation, and we are seeing the positive results of the hiring and retention program. Again, we're having our best class now in almost 5 years coming in for recruits. But also, in addition to that, is outside of just from a monetary standpoint, we're doing more to, for example, as you know, a year or so ago, we started a full-time wellness coordinator. So we have a much more robust wellness program in terms of looking at the stresses that staff have. Also, in terms of training and giving the officers more tools through training. Also, in terms of what I mentioned, the increase in technology. I mean, all the things that we're doing to help supplement and help officers in terms of keeping the facility safe. All the various technologies for screening and other areas that just help the officers do their job better.
Okay. So speaking of training, the budget has $85,000 for a staff of almost 1,000, which seems very low. Even compared to other DC agencies, DYRS's training budget was 10 times that. So am I reading this line wrong? I'm seeing some head shakes.
But no, and I'll have also Deputy Director Wilson speak to it because training comes under her. But specifically, that does not include, so that's outside of our training, like our training academy, all the training that we do within DOC. That's not part of that.
Okay, so what is that for?
So mainly that is for outside trainings, or if we have to bring in some specialized trainings or do train the trainer type programs, which we typically do. So we have a full training academy and full staff at our offsite facility, our Center for Professional Learning and Development. So we do most of our trainings in-house, but if we want to create a new training program, or we will send people out for train the trainer type programs or any specialized, and then they bring that back. Those trainers will bring that back and provide those trainings to our staff and our team.
So that's outside of the comprehensive training we provide within
Got
the
it.
department.
Okay, thank you for that clarity. That was concerning. And then in terms of the staffing level, are we at about 1,900 people, not in the staff in staying in the jail?
Yeah, as far as the jail population?
Yes.
Yes, around, we've been running about, it varies up
Right.
and down a little, but around 1930, 1940 in that range.
Okay. And how
I believe
many?
as of today, we were right at about 1940,
Okay.
1934, I was told.
Okay. That is similar to what it was a couple weeks ago. So in terms of the COs, how many full-time COs do you have?
710 field correctional officer positions.
Okay. And we can do some math on what that ratio is, but what is the ideal staffing ratio for CO to detainee?
I mean, we don't have a like a staffing ratio in terms of what's ideal. I mean, we have posts that we fill, but in terms of an absolute ratio, like one staff per individual, that's it doesn't work that way. I mean, we base it on posts.
Okay. So I guess then in a different way, how many vacancies do we have for CO positions?
We have about 106 vacancies for correctional officer positions.
So there's $400,000 for promotional hiring incentives that I think is just a one-time enhancement. So this is what I was trying to get at earlier of like some of the efforts that had been underway this past year potentially could look different next year with this one-time enhancement. Not that that's a lot of money, or is that planned to be used for the same type of purpose?
Same, again, this is ensuring the continued funding for what we've been doing over this past fiscal year into FY '26. So within our incentive and bonus program, there's incentives set up both for a new hire, and then there's a further incentive as part of that program for if that person is hired, then once they complete their full training academy and their probationary period, there's yet another incentive there, which helps with retention. And then there's, as part of that program, there's actually an incentive for current staff that are already on board for referrals. So in other words, that's one of our best areas to get new qualified staff is if someone that's already employed by the Department of Corrections happens to refer someone that they think would be a good candidate, and that candidate then is hired, then our DOC staff person gets a referral bonus. So it's been a good program, and again, that will now continue through the FY '26.
And just briefly, I just wanted to say that we actually received this funding for FY '25. And so, and FY '25. And so actually FY '26 will be the first time we'll be paying for the recruits who've completed the 18 months probationary period.
Gotcha.
So that is actually also another incentive for retention, because they will be the first group in FY '26 where the 18 months will have come up and they're qualified to receive those funds.
And has it worked as a tool?
I would say yes, because they are very much aware staff is aware of the incentive program and the requirements for completing the incentive program. And the recruits are very, and probationary employees, and I want to say privates now. The privates are very much aware of the incentive. And so I think they look forward to it, and people are making the referrals, which is exciting as well.
But have we seen that enthusiasm translate into new positions coming in? Like if you're looking at monthly averages, let's say.
So it's specific for correctional officers. And so I would say yes, because as the director has said, we are the next class that's set to start on the 23rd of June. We'll have almost 40, which is the largest that we have had, significantly larger. And then even as we look at where we are in terms of the next group after that, we are already working on the next group after that. We have well over 60 people just in the various stages of the process. So I'm not saying everyone will pass and move on to the next stage, but that's just where we are for the next class that will probably start in the next fiscal year. So we're already working on that next class, and we have several months to go left before we're ready to start the next class after that. So I would say yes, that it is working, because we are seeing a much greater, and we've had to we do a weekend a Saturday where we invite people in, and we've had to add, for the first time in a long time, have a group come in on an off weekend so that we can do the testing and the different parts. So that is a plus.
Great. Okay. Thank you for that. The Education Services has a $3.1 million investment to support Maya See Forever and their contract. What's the status of that solicitation?
So we're in a Option year one. Yeah.
We're about to enter we're in option year 1 right now, and we will begin option year 2 in November.
So there's not a solicitation out, it's an option year.
It's
Continuing.
Got it. Okay. And how many students can that funding serve?
up to 45, but it's up to 45, but we have worked with Maya and continue to work with Maya. If the student population increases, they will continue to serve an increased number of students. And we have worked and made arrangements if the population does increase.
Okay. And how many students on average are being served? Like is 45 about in range, or are we traditionally lower or higher than that?
No, anywhere between 45 and 47 a month.
And you're doing the IEP testing?
No, they come with the IEPs already. So we don't do the IEP testing for special education. That's done prior to them coming to the facility.
Oh, but one of the things we talked about last year was if a student has not received their IEP designation, to make sure that they were covered in services that they may, educational services that they may need.
So we don't have a diagnostic center to do IEP testing at the facility. The students that come through OSSI already have an IEP on hand. Those adult learners that don't have IEPs, we do tape testing to determine what levels they are. And then we place them in GED or ABE or lower literacy, depending on what their tape testing scores are. And then we carry out their adult education that way, but they do tape testing for all other adults that are not under a special education umbrella.
Understood. Okay. Okay, so when we think about the work of the Ready Center and other partnership with reentry, and I know you all have been helpful partners and kind of leaning into this, we've had a difficult time getting efficacy metrics for how long someone has been reemployed, for instance, or if they've secured housing. And so in working with this population, how are you thinking about tracking those metrics with the Ready Center or other preparatory tools that you all can be providing more of while people are at the jail?
I'll ask Deputy Director Williams to speak to the Ready Center program.
Okay, can you ask one more time so I can be sure that I have the right
What
question?
metrics are you tracking for successful reentry?
Okay, so we are tracking the number of participants that are participating in programs. We track those numbers of persons that actually are seen both pre and post release for Ready Center. We track recidivism rates for those residents that we have completed what we call a interest form on. So for all residents that are on a reentry track, they are seen by our outreach specialists inside the facility. They complete a interest form. Those interest forms tells us what areas of need that they have, as well as we utilize the North Point Compass Risk and Needs Assessment tool that allows us to know what are their areas of highest risk to recidivate and highest risk to commit a new crime or a violent crime when they return back to the community. But we do track recidivism rates for all residents that are on the reentry track, as well as those that are connected to Ready Center as well.
Okay. Do you track access to employment or housing over time?
So yes, we do track those that come into the Ready Center, but the way the Ready Center work is a referral system. So for anyone that's being referred for housing, anyone that's being referred for employment, like DOES is in the building or DHS is in the building or Voices for a Second Chance or DMV. So for those service providers, once the referral goes to those agencies, they track those numbers as well. So we track the referrals that we give out to the other program providers or municipal partners, and they have a tracking system in place for what the outcome would be for that resident.
So for example, on an employment, if someone were returning citizen were to get employment, then that would be DOES, who's in the building with us at the Ready Center, would have their own tracking metrics in terms of how long someone may or may not have been employed.
Right. I guess what I'm trying to figure out is how we can close the loop a little bit. Like, it doesn't make sense to track things for tracking's sake if we're not driving forward improvements. So if we saw that, you know, a high percentage of people were most likely to be reemployed or stably employed for a period of 12 months, and then backed in to see their history at a specific training program that you all were offering or educational program that you all were offering, we could then advocate for expansion of that program. Or on the flip side, if we saw one training program lead to unstable employment, and I worry that if each agency is only looking at tracking their specific numbers, that we're not kind of working together to drive forward those improvements.
Well, there are a number of job training programs that we conduct in the within the facility and within the Ready Center. Again, with Deputy Director Williams' unit, we really start reentry the day someone comes in.
Mm-hmm.
And so we've established just recently a number of new trainings, such as, plumbing, such as painting, hair, cosmetology. You might speak on some of those.
Yes, sir. So as the director is saying, we look at reentry from intake. We have closed a lot of gaps during intake to ensure that we now have the live orientations. So that allows for residents who are coming in to know exactly what's being offered inside the facility. We have the data around how many persons are coming in that are employed or not employed, what were their educational levels coming in. And a lot of that's self-reported, unless, of course, it's Maya, where we're able to work with the school system to get those documents. And so that self-reported data is inside of our JAX system, and we utilize all of those tools, as well as the interviews that we have inside of the intake unit, to kind of allow us to place residents in those areas that we know that they're most vulnerable to recidivate in. But we have adapted the inside out approach. And so a lot of the programs and services that we provide inside the facility is carried on into the community. And those things we're able to track. We're able to track if a resident received 350 hours of cosmetology inside the facility, and they move on to the Ready Center, and they complete the portion at the Ready Center, and then they're actually placed in a licensed hair care school like BCI or something like that. So plumbing and painting, they start their apprenticeship programs, pre-apprenticeship programs inside the facility. If they don't complete those hours, they go to the Ready Center, they go out into the community, and they receive those hours, and then they're connected to a labor union. So we're able to track all of the programs and services that we offer inside the facility as well as outside of the facility. I guess the challenge would be is to make sure that all of the partners that we're connecting with, that we're able to kind of look at it as a whole to track everyone that's coming out. But we do track everyone that comes out that connects to Ready Center as far as recidivism rates. And we also, just one more thing, for the Lead Up, Lead Out program, because that's an employment component as well. We track and we follow those residents for a year. So while they're in their job readiness training, when they go to their workforce development placements, and when they have their full-time employment, there's retention specialists, there's job coaches, there's peer navigators that are connected to those residents. We have currently our second cohort for the Lead Out program inside the community. So we track those residents for a year. We also track those residents when they come back, if they recidivate back into the facility. And that's one of the questions that we ask. What were some of your challenges in the community? And what were some of the barriers that you faced that brought you back into custody? So.
Okay, thank you. That's very helpful context and good to hear. And I I guess as I think about a year, I just want to make sure that we're closing the loop with DOES. Like if they're tracking somebody who they're helping with secured employment 24 months, 36 months after, and we know what you all did that was really successful. I want to know what that is so we can continue supporting those efforts, and the flip side.
Absolutely.
So in terms of the culinary program for the Aramarks Into Work, how many residents participated in calendar year 2024?
I'm
I
sorry.
think that's the
Or fiscal
year.
year. Fiscal
Yeah,
year is
I mean,
okay. Yeah.
No, that's to date. So let me get the 24 numbers. So
Got
to
it,
date
okay.
for 24 through 25, we had 78 that have participated this year. So I'll give you you said calendar year for 24?
If you have it.
I do.
And how many are in each cohort?
We're averaging around 15 to 20 per cohort.
And how much does that program cost?
So that's no cost to the agency. That's a part of Airmark.
That's provided through
offers
our
that.
vendor Aramark for food.
I know, but I mean, is there a separate contract for that program coverage? Or it's in your Aramark contract for the basic number? Okay,
Yes.
There is no separate.
got it. How many young men emerging units are funded in this next year's budget?
There's no funding for the YME program.
Does that mean it's not going to continue?
No, so we have in-house staff that runs and operates the YME unit, as well as a ton of partners that come in and also offer services and programs. We have a dedicated staff member that is on the unit 5 days a week.
Yeah, we run a full YME unit.
Gotcha. Okay. And how many men are living in that unit?
Right now, I think we have about 15. I'll get the exact number.
Is there capacity to increase that number?
Absolutely, yes.
What's the library budget for next fiscal year? I saw 3 positions in the budget for library technician. Only 3,000 for supplies and materials. Is that correct?
Yeah, the library budget, we work with DC Public Library, and so the library budget remains unchanged from this year, from FY 25 to FY 26. So there isn't any change in the budget. We do have our own law library technicians who assist with providing documents through FastCase and LexisNexis for library services.
Okay, what I guess I'm trying to address is the vacant positions that seem to be in the library, if that's affected the hours or the ability to open the library.
So the library is staffed by DC Public Library, and so that is staffed. Yes, DC Public
Yes, it's
Library is
fully
fully
staffed.
staffed. We have a position open for our law library
tech.
technician. And that is we have other staff who are assisting in that area until we are able to fill that position.
Got it. Okay, but the library is open.
Yes.
And the law library is
Both,
open.
yes.
So there is no physical law library
Library.
location. And this has come up several times, so I just want to take 1 second to
Yeah,
address
sure.
it. The actual law library was essentially a set of computers that people went on and used LexisNexis. And to make it easier for our residents, everyone now, everyone has access to a tablet. And so the LexisNexis is available on the tablet. So everyone has access to the tablet to be able to look for cases, to search at their leisure. And if you have an educational tablet, we have FastCase on the educational tablet as well. So you actually have, many residents have 2 ways to access legal research. Then what they do is they can print out, they can request to have the document printed, like they want to to print it out and have it to present to their attorney or whoever, they can request through the law library technician for the document to be printed and to be brought to them. If they need assistance with how to access the fast case or LexisNexis, they can request that, and the law library technician
to the unit.
will come, or the case manager will come and assist them, so they show them how to use it. But the actual law library was just a set of computers where they access. There were no legal books. Most people don't use the books anymore or collect the books anymore to do the open research. It was all computer based. And so we have the tablets that provide those services. So everyone has law library,
Access.
yes, access.
I
on
got you.
chips.
Okay, thank you for
Yeah.
that clarification. No, I appreciate that.
Clarification.
I needed
We've
that.
had
Yeah,
about
thank you.
7,000 library requests for this fiscal year. So that's
Wow.
the actual paper document that they want printed out for them.
Okay. So let's talk a little bit about the health services budget. It seems an increase of 1.4 million. Is this for Unity or for DOC staff?
It's for the Unity contract. It's Unity's contract.
Okay, so how much will the full Unity contract be?
Yeah, $50 million.
50 million.
Right.
Okay.
And we just recently renegotiated a new contract. So that contract is for, all the medical services, dental, the whole range of medical services, mental health, everything is within that contract.
Okay, and will there be additional services provided under that contract this coming year? Or is it the same as we've been providing?
There are more services in terms of things like more, I don't know, aggressive isn't the right word, but more comprehensive in areas like prenatal care and other areas. You may want to speak to some of them.
So the Unity contract began January, the official new contract began January of this year, 2025. So we're currently in the start of the Unity contract. Some of the areas that are specifically enhanced, one of the areas was dental, is a new, we had dental before, but it's much more comprehensive, because what we were seeing is that many people came in with dental issues, which creates other issues, which need to be addressed. So we did some enhancements in the area of dental. Of course, we continue our MAT services. We continue the comprehensive medical care. Some of the things that we created or that were added as enhancements during the pandemic, which was the 24-hour sick call process. Now that is part of the contract. So in addition to continuing with urgent care, sick call responses within 24 hours, which is now part of the contract. And then again, we still maintain the chronic care services that we continue to have. We have behavioral health, mental health services. And so we've added those. And again, as I said, MAT is another large portion, which we continue with Unity as well.
Are you seeing any different trends in residents' healthcare needs, whether it's physical or mental?
Yes.
And what are those?
Yes, I think one of the biggest things we've seen particularly since the pandemic, and just the nature of the individuals, the type of charges we're seeing people come in, but our population, we see a significant number of people with mental health illness and issues. Again, one of the things we frequently say is that we get people as they are, and and so many times people in the community don't have or not seeing medical providers. And so that falls on our medical staff to not only have to to address behavioral mental health, but also the challenges of chronic care conditions and the like. So there is a lot of chronic care conditions that we continue to see folks needing care and services for. And again, that's why dental was such a big part of this new contract, because we saw that as a need based on what the change in our population as well. So again, yes, and again, we continue to address and look at, and I would be remiss if I didn't talk about our MAT and our work with DBH on MAT, but also Unity, as well as on the work with MAT.
Yeah, and our, in addition to mental health, substance use disorders certainly are a big issue. And as mentioned in our MAT program, medically assisted treatment, we have now over 500 residents on our MAT program to, try to eventually get people off of that, needing this for the substance use. So we have really, in terms of local jail systems, we are truly like a national leader in the use of a MAT program in a local jail facility. So those are probably two of the biggest areas that, continue to be a real issue, or three areas would be mental health, substance use, and again, more chronic conditions, getting people that are already coming in with a lot of health issues, as the deputy director spoke to, with, the need to have a wider care in terms of oral care and dental care, for example.
Have we been tracking the efficacy of the MAT program? Again, after somebody may have gone on, or if they return to the community, to see if they have relapsed 6, 12, 18 months down the road?
So we actually we work very closely with DBH and this is part of the SOAR funding that we receive through DBH. But we are tightening up and working very closely with DBH in terms of being sure to track folks who are in our facility, and then also once they leave. So that does turn over to DBH, but we are doing our part in trying to ensure, and we actually DBH funded in the latest SOAR grant for us to add a position in terms of just doing what's called a GIPRA. I never remember what it stands for, but which is the tracking mechanism. And so that we have someone whose job it is to just, and they actually just started last week, whose job it is to just meet with residents, get all of the GIPRA information, and then provide that with DBH so we can have a more seamless process to be able to hand off to DBH as they track in the community. Because they are the one, it does turn over to DBH once they're back into the community. And so we realized that there was a gap and that we needed to make that a more seamless process. So we're working to do that now.
And the GIPRs are a risk and needs assessment that DVH DVH uses, and it is for the most vulnerable populations, which are SUD and our mental health, our persons with mental health diagnosis inside the facility, as well as when they return back to the community. So a lot of those persons are also a part of the workforce development program that we have over at the Ready Center as well.
Okay, let's talk about my favorite topic, food. Secure DC, as you know, included a section that sought to improve the nutrition standards and add hospitality training at the jail. I'm disappointed that there's not funding in this budget to fully implement that. But I'm also looking at the inmate health and food services contract, which looks like it's facing a $16 million reduction. So walk me through what's happening with our food contract and what we can do to improve the nutritional standards.
There's no reduction in our inmate health or food contracts. I mean, it's there's like a extremely nominal there's no reduction in our food service and also.
Okay, so it's possible it's coming from somewhere else, but the local budget indicates a decrease $514,000 across multiple divisions to account for equipment supply. And then the budget says it's decreased by 16.5 million in contractual obligations to account for savings for inmate health and food services contracts. That's from your budget documents.
What line are you referring to? I'm make sure I'm looking at the right chapter.
This is from the summary of the DOC's operating budget proposal.
It's, yes. So I think and I just want to pull the chapter out. I'm sorry.
Okay, take your time.
No.
I believe it because if you look, it turns into an enhancement. So while there's an initial reduction, it looks, I think it's this.
Oh, okay. Gotcha.
I think if you look, there's, removal of the one-time funding, and then if you look, there's enhanced to support inmate health contracts of $40 million. So it's initial reduction, and then there's an enhancement added back, and then it's added back. in.
Got it. Okay, so is the enhancement actually $24 million?
Yeah.
Yes.
Okay, that's what we like to hear.
Yeah.
So tell me a little bit more about
It's
what
not a
that's gonna
cut.
be used for.
It's primarily to cover the healthcare, the Unity contract. So there's no real change in food in our food contract. But the enhancement is to cover the increase to the Unity contract, the medical contract.
So there's been no additional negotiations or conversations with Aramark about increasing the nutritional standards.
There's no increase in terms of contractual. We continue to work with them. Well, first on the training piece, we do, as you saw, we continue to have the into work training, culinary training. And what we're also expanding on now, and again, this is at no cost to the DOC, but we've had and have had meetings with Aramark in terms of we want to expand to essentially a phase 2, so that once you get the certificate of training for through the Into Work, that we would, for those individuals that would continue to be incarcerated, that prior to their release, we would continue their culinary training beyond just, the fact that they got the nationally recognized certificate for food management, but to continue training. So some of the things we've done, for example, we've recently moved individuals who graduate from that program, where some of them now are working in, for example, the doing food preparation in the officers' dining room, so that we can continue to do their training so they don't graduate, and then that's kind of the end of it. So we're making that training continuous, and then we have continued to work in terms of we're adding, again, at no additional budgetary costs, we're adding in a couple new programs that we're going to be piloting here in the next couple months, through our vendor. One is called the Eye Care program, which provides families and friends to order a special, if they want to, on a birthday or something, they want to order a special item, or that they can do that. And again, those individuals that we have through our culinary training programs would be the ones that would be preparing these more special meals. We also will be piloting what's called, and I'll say the Eye Care program is where you can go to family members can go to a online website and actually place an order through there. Then we will have also what's called Fresh Favorites, and we're going to be piloting that, and that allows a resident, and it'll be a certain menu above and beyond the daily menu, where if they wanted to order, maybe a cheeseburger, they could put in an order for a cheeseburger, and that would actually go through the commissary process. And again, that item would be prepared by individuals that, so we'll continue that training. So not only does it allow for the resident to have this, but on the other side, it's providing more ongoing training opportunities in food service.
Okay. And I appreciate that. And certainly, that is a very nice thing to make sure on a special occasion, somebody can have a treat. I guess what I'm more concerned about is recognizing the impacts of nutrition on physical and mental health outcomes for folks at the jail. And the opportunities for treats example don't necessarily fall into that category. And I know we talked about this last time, and Deputy Director, you made some passionate and well-received arguments about making sure we're not just, giving people a bed of lettuce and vegetables, that they might not only want that. And I can understand that. But similarly, as we think about the nutritional standards in our schools, these are people in our care and custody, and I think is very important to improve and increase the nutrients that we are offering to people, and fruits and vegetables to do so. And the funding costs for the Fresh Starts provisions in Secure DC were estimated at 4.3 million. That was to include the nutritional standards increases and the more expansive hospitality training. So I appreciate everything going on with commissary and with the culinary training, but do you have a breakdown of how much it would cost if we bifurcated those interventions from the food standards piece and then the hospitality standards piece?
I do not have a breakdown at this point. I do think, though, it's important to, and I know I've said this before, but it's important, I think, to note that our menus do meet all USDA dietary allowances. And I believe that's important to note. I've looked at other area facilities in the DMV just to see, like, where do we stand?
Mhm.
And in terms of the dietary allowances and the looking, for example, we serve based on the servings and the calories. We have a 2,800 calorie menu. Arlington County, Virginia has a 2,800 calorie menu. Fairfax County has a 2,900 calorie menu. Prince George's County, Maryland has a 2,900 calorie menu. So my point being, we in the district are right in line with other correctional facilities, and we do meet the federal guidelines for dietary allowance.
Yeah. And I appreciate that. I don't have oversight over the USDA, but if I did, I would tell them the same thing, that I don't think those are appropriate standards either. There are still recommendations to eat grains and sugar at higher levels than vegetables. I mean, that's just, I think we're going to look back years from now and be amazed that that was recommended, and it's still being recommended to our children. And so as we think about, as you have been the leader in many other areas of the jail, I want us to recognize not just being in line with the standards, to be ahead of the standards of really making sure we're feeding people things that are going to make them healthier physically and mentally.
And there are some things, and I think I've noted in the past, that we continue to work around the edges, so to speak, where we can make improvements. Now, one of the things we did based on input and surveys of the resident population was we made some changes in the menu cycles in terms of certain things they like to see or don't like to see as often or whatever. So we've made changes there in the terms of the cycle offerings. We do every day at lunch, there is fruit juice that goes with lunch every day. That was essentially an add-on. And then there's fresh fruit is served 3 days a week.
Well, thank you. I look forward to continuing this conversation. And I'll just add, on the hospitality training front, one of the things that I am in communications with the Washington Commanders about is to expand and allow for job opportunities for returning citizens, not just in construction jobs, but also in the thousands of permanent jobs that are expected at this facility in sales and marketing and concessions and management. And one of the things that we've had some conversations about is if there could be training in the DC jail that they could help operate to start the onboarding early. So I just wanted to put that on your radar and hope we can work together on something like that this coming year, as there will be a lot of opportunities available, I hope, for our residents. I'm going to turn to my at-large colleague, Councilmember Henderson, for a 10-minute round. I will note, Councilmember, we are kicked out of this room at 11:55. Go
10
ahead.
minutes. So let me get to it. Good morning, Director. I wanted to start in asking about recruitment and retention. So at performance oversight hearings, we discussed the positive recruitment trends that the bonus, the retention, and the referral incentive program have created. Your budget includes about $400,000 proposed for these efforts. Is it to continue it in its current form, or does it represent an enhancement that will allow for you all to hopefully recruit and retain larger classes?
That will continue our efforts from FY25 into FY26. And as we had noted earlier, we're seeing very successful results in terms of that helping our recruitment. Coming up in the end of this month, we're going to be starting the largest recruit class that we've had since the pre-pandemic in 2020.
How many is that?
About 40, I believe.
40. Oh, wow. Okay.
So that's music to our ears. And so yes, we're seeing the results. Not that, it's 100% because of that, but
Yeah.
it's very important, and we're seeing successful results from that. And also, it's a very important program in terms of, we need to keep up with the other localities in the other jurisdictions.
Right.
Because many of them, as you know, have various signing bonuses and all.
Yep.
So this really keeps us competitive within the market, which is important.
Okay. Now, I know from some of the other agencies that even when you bring in a particular recruitment class, not everybody makes it through training and all of those different things. On average, what's your yield in terms of, let's say you bring in a group of 40, how many of them are actually going to make it to the end?
The vast majority, I mean, we are doing pretty well. I think in 23 class, we lost maybe 2 or 3. And then I think we still have all the recruits or privates now from 24.
Okay.
And so I think it's been pretty, I mean, it's
That's way better than
Yeah,
some of your
yeah,
other
right.
public safety partners.
right. We maybe I would conservatively or probably overly stated 1 to 2 per class. we
Okay.
might lose, but that's about it, but not that many.
So how many vacancies do you still have right now?
We have over 100 correctional officer vacancies.
Okay. Okay, so still some more work to do there. This year's budget supported DOC's acquisition of new body and package screening devices. We talked about this a little bit at performance oversight. How many have you purchased? Have you received them yet? And is there funding to continue to procure these through FY25?
Yes, we've purchased and are operating. So we
Okay.
have a number of different screening technologies, everything from mail screening devices, document screening, full body scans, screening devices that have been employed.
Yep.
We also have other screenings for, X-rays, metals. so
Right. Well, and one thing you said in your
a range of technologies.
Well, one thing you mentioned in your testimony is that you all have new narcotics trained dogs.
Yes,
you've
we brought on
introduced-
board. Well, we've always had narcotics trained dogs, but we've just recently brought on 3 additional.
3 additional. Okay. Are these, I don't want to question the effectiveness of the canines, but have they been effective?
Yes, they're very effective, particularly on targeted searches of areas.
Okay. All right. In terms of contraband, and we've seen this in terms of narcotics or other items, have we seen a decline this year based on the new well, I wouldn't really call them new, but I would say based on some of the reforms and changes that you all have made in the past year?
A decline, I'm not sure about a decline. What I would say that is very, from a successful standpoint, is we're stopping more.
Well,
So,
that's what
yeah,
I'm saying. Yes,
right,
stopping
right.
more from actually entering the facility.
Yes, yes, we're definitely seeing that, particularly through a couple areas, but very effective. We've stopped a lot of attempts for particularly drug contraband coming in through the form of documents or through the mail, trying to get that in. Also through our full body scans, which allows us, without having a intrusive body search, but have a scanning device that allows to detect possible contraband that might be, hidden
Right.
in certain areas that otherwise would not be detected.
Okay.
So we're definitely more successful in stopping it at the front door, so to speak. The troubling part I would have to say is that there continues to be, or I would say, an increasing, almost a pressure. And in one way, it's a good thing because we're stopping more. So there's almost an increasing pressure to try to find ways to get items into the facility.
Okay.
And as an example,
Individuals getting more creative.
trying to get more creative. And as an example, unfortunate, but we have a couple cases going on right now, for example, where we have programs that are beneficial programs for the residents where, volunteers come in to help conduct these programs. Unfortunately, we've had cases recently where volunteers have been trying to bring drugs into
That's unfortunate.
through the program. We're finding more again, but we're stopping it. We're finding more attempts to pass drugs through the visitation process.
Yeah.
But again, those technologies are doing a much better job of stopping it at the front door.
Yeah.
So it's good news. The good news, bad news. The bad news is there's more and more attempts and trying to figure out methods to get it in.
Yep.
And the good news is we're stopping more.
Well, I mean, look, I think anytime we get alerts about someone who has had an overdose, whether it be in DOC custody or DRS custody, there is always alarms in terms of how that material got in. On the other side, right, I've had conversations with Unity Health in terms of the SUD operations that they're running in the jail, which actually might be one of the largest in the city. And how do we make sure that, one, Unity has what they need and that they are keeping track of individuals, but also when those folks move on to other locations or are released, that we're connecting them in community.
And that's one of the things we're really trying to do in Unity. I mentioned earlier, we have over 500 residents now on our MAT program, our medically assisted treatment program, to really to help them recover and hopefully not seek drugs. So that MAT program really in terms of correctional facilities, we're a leader in that area.
I know. And also, like I said, the biggest in the city. So we want to make sure that it's going well. I need to ask you about the Safe and Supported Pregnancy Amendment Act, the FIS in particular. This is a budget hearing. It is budget time. So this is now my opportunity to fund what you all say you need. Just as a reminder, the FIS for this bill requires 3 additional FTEs to coordinate support persons and to increase the number of visits that incarcerated folks can have with their young children. Setting aside Section 11 of the bill, which requires the additional visitation, I just wanted to ask some questions. DOC recently published a revised pregnancy policy following the passage of this law, and I want to thank you for sending that document to me. In Chapter 4, Section 11 of the revised policies, it talks about the coordination of a support person for pregnant residents, which indicates to me that DOC was planning to move ahead with implementing this without needing the additional FTE that says in the FIS.
Well, no, and I'll have the deputy director speak to it too. So we do have in our revised policy, the ability for requesting a support person and in fact approving a support person, which we've always been supportive of. And as you know, prior to that, though, it was on a case by case.
Right.
And appreciate your legislation there, which we agree with. So yes, within what we're doing operationally, we have a system now set up as laid out in our policy for a support person to be requested, to be designated, and then to provide those services at the hospital. But in terms of the FIS, there's additional requirements within the legislation that we would not be able to follow through beyond just strictly
Just the support
focused
person.
on just the support person.
Okay, but the support person was one of the FTEs that you requested. So that's why I'm like,
Well,
can I take one away?
No, because, and just basically because the legislation had some very specific timelines in which, like, in terms of even, and I think some of that we were, in terms of being able to, accommodate, in terms of our policy, being able to, have our approval process done, that's fine. But in terms of notification, in terms of timing, there's very specific, like, someone has to be on call and available. Like, labor is not a, hey, I'm in labor at 11:45. It could be at 12 o'clock at night, in the middle of the night. It could be 1, 2 o'clock in the morning. And there are some very specific sections within your policy which require, which in the legislation, which require notification within an hour, different things that a person, we need a body to be able to be responsible for those notifications and those specific provisions which require those different things. And then that you're tracking, and the various areas. And then your legislation also, and I know you said taking this aside, but the legislation very speaks to, if you have a child over a certain age, you're entitled to visitation. It's not limited to for women, it's for the entire population, men and women. And so then you're looking at a population of we have to then look at a population of 1,900 plus individuals and then figure out who has children under a specific age, and then they're all entitled to visitation. That also is a tracking, and I mean, because we don't necessarily track very specifically who has children under this age, and to meet this, and that is all required as part of that person and those people, in addition to needing additional officers to be able to do that work and visitation. There is, that person would be responsible for that part of the legislation as well.
Okay, let's talk more. I'm over my time, and I know that the chair is on a time crunch. The other thing that I would love to talk to you all about is your contract relationship with Maya Angelou, in terms of providing the educational services, but I can certainly follow up on that. Thank you.
Thank you, Councilmember Henderson. Okay, I have a bunch more questions and we don't have a lot more time in this room, so we're gonna do what we can. In terms of the MAT program, and I certainly am thrilled that we have this program, and I know it's just unquestionably difficult to deal with substance abuse disorder, and to help people transition off is very important. As we also weigh the need to keep all residents in the jail safe, I'm very concerned about the overdose deaths. And I have heard that there have been some instances where people may have taken the medication and then distributed it. And so is that something that you're tracking in terms of the MAT program, to make sure that somebody is in that program, that they are consuming their medication kind of on site with the medical provider, and not taking drugs and distributing them throughout the facility?
Yes, we have what's called watch take, when they take a particular drug such as that. Also, there have been, we or Unity, keeps strict controls over, for example, Suboxone, which is one of the drugs that are used in the MAT program. So in terms of, we have had cases where we found Suboxone in the facility, but it has not been Suboxone from the program. So in those cases, I mean, I know you mentioned giving away Suboxone, but I don't believe that's the
So you have
case.
heard of none of those cases where
I don't,
it's not a trick question.
I-
I just,
no, I don't know. I can't sit here and say there's never been a case, but I can tell you that there's strict accountability and accounting for the program.
So there's a really
For
strong
the
watch
drug,
take, yeah.
there's a strong watch take and there's a strong programmatic accounting of that.
okay.
And and as the program has
So
expanded, yeah.
I'd have to say, what you'd be referring to would somehow again would have come in from an outside source.
And as the program has expanded, we've had to make adjustments but our operations team we have it down to a schedule in terms of working with medical and operations working with medical, and to ensure that the watch take program occurs, and where we distribute the medication as well. So I think there have been some growing pains throughout, but I don't think there's any recent or specific cases. And again, if there is a case or a situation where contraband is found, we have been going back to Unity and actually checking, and they have protocols that they have to follow as part of NCCHC accreditation, in terms of tracking medications and the like, and also for their licensing. And so they're able to account for and provide those records to account for, and even how the Suboxone looks. Typically, theirs has a specific look to it. So when something is recovered, that's also an indicator oftentimes of whether or not it could be from Unity or someone else. And we haven't found any recent cases where it's a Unity medication because it doesn't match the look doesn't match as well.
Okay, that's helpful information. Thank you. I want to talk a little bit about the auditor report that came out. So the report details a number of very concerning things. One of which is 400 documented staff use of force incidents over the audit period. In 2020, DOC established a violence reduction committee to review use of force incidents for root causes, action steps, training, accountability, and behavioral mental health contributors, but did not produce a report and did not meet in FY 2023 due to stated staff vacancies. What's your response to that element of the report and other other concerns raised in the report as we think about this budget advancing your ability to make improvements? I should also just note the maintenance concerns in the report I'm curious about too. Showed over 1,500, almost 1,600 maintenance reports that posed immediate risks to health or safety.
Well, again, speaking for the maintenance reports, I mean, that could be that literally includes everything from a leaky faucet to a drain that needs to be snaked out or whatever. So it's covers a wide range of maintenance reports. I would say in terms of the ODCA audit, if you really want to call it an audit, it's just really based on us providing them a requested documents. For example, the number of maintenance calls without any differentiation of what those maintenance calls are. So there was never I think it's important to have an understanding that within this ODCA audit or review, there was never a request for any on-site visits of the jail. So no one ever came into the jail. No one ever visited any unit or any operations of the jail. This was strictly based on providing documentation. For example, how many maintenance calls there were in a year. So it's really hard to break down some of your, some of your question there, in terms of specifics. But again, we, certainly, as you know, we provide the council with, quarterly council reports, with a lot of those numbers, be it assaults or other types of things that we provide on a quarterly basis.
Do you know why they didn't visit the jail? Like, did they make a request to visit the
There
jail?
was never a request to visit the jail.
Have you ever been audited without a physical visit?
Uh, not that I can, recall. And again, we are, audited very thoroughly, with actual on-site audits. As you know, we're fully accredited by the American Correctional Association that comes in for a 3 to 4 day on-site, audit. We're certified by the National Commission on Correctional Healthcare through Unity, which is again is an on-site audit. As you know, we have CIC that comes in, for on-site audits. So, and all these are conducted by certified auditors who are subject matter experts. There was no one, to my knowledge, in this audit that had any subject matter expertise in corrections, much less the fact that there was never anyone on site. But so again, there was, in my opinion, that this was an audit and a report with a preset agenda, which is fine, with the preset agenda being the need for a new facility, which was pointed out. I don't disagree with the need for a new facility. The mayor doesn't disagree with the need facility, and I know, that you don't either. But in terms of being an actual audit, as opposed to a report, that to try to further the groundswell for a new facility. I think everybody's, in agreement that, the district needs to build a new facility.
Yeah, and I think, like most things, both things can be true at the same time, that we need a new facility, and recognizing even on an expedited timeline with the public-private partnership, that we can benefit from some habitability improvements at the current jail. I know you all have been focused on the HVAC improvements over the last year, and even some of these leaky issues, and we'll certainly talk to DGS about that too, to make sure everyone staying there and all your staff can be in a safe and habitable environment. I want to ask you, Director Faust, before we wrap up, as you look at this budget, is there anything else you feel that you need to carry out your mission?
No, I feel the budget as it exists today, absolutely allows us to carry out our mission. And I'm very appreciative of the fact that, and I don't know where we stand with other agencies, where we may be one of the few that actually are looking at a 3.1% increase over the last fiscal year. So we have the resources within our budget to do what we need to do.
Well, thank you, Director. Thank you to your team. And the time is 11:57 a.m.